Metformin is the only biguanide and it is the initial drug of choice in the treatment of diabetes mellitus. The main mechanism of action of metformin is reducing the hepatic gluconeogenesis because excess glucose production by the liver is the major source of high blood glucose in type 2 diabetes patients. Apart from that, metformin also slows intestinal absorption of sugars and utilization in the peripheral tissues, thus reducing insulin resistance. Metformin can also cause loss of appetite, so the patients may lose weight, which is an added benefit. Unlike sulfonylureas, metformin doesn't promote insulin secretion. Therefore, hyperinsulinemia and the risk of hypoglycemia is far less than other drugs. Metformin is well absorbed orally and it is not bound to serum proteins, and it is not metabolized in the body. Excretion is via the urine, which is something we have to pay attention to because it's contraindicated in patients with renal failure due to the risk of lactic acidosis. Side effects are mainly gastrointestinal like nausea, vomiting, and diarrhea, but long term use may interfere with vitamin B12 absorption, causing vitamin B12 deficiency. Metformin should be discontinued in cases of acute myocardial infarction, exacerbation of heart failure, sepsis, or other disorders that can cause acute renal failure.